Hello, and welcome to Rejuvenous TV Skincare Academy, starring one of Hollywood's most sought-after doctors, Dr. W. Ray Henderson, and his beautiful host, Jamie Fierro. Here, you will get all the answers to your daily skincare questions. So stop aging and start living here at beautyplum.com.
Sensitive skin. I'm here with Dr. Ray Henderson this evening, and we're going to be discussing sensitive skin and how it is affected by different products.
If somebody experiences some sensitivity to products, can it ever be so bad that it permanently damages the skin?
Certainly. I think that there are times when you get third-degree burns, which is through the dermis, and it heals by scarring. And once a scar, always a scar. So that's definitely true. And I think if products like that, I would expect to have warnings on them. But I think people should crawl before they walk. Use the products that are well accepted, well utilized, and don't go to those that have a reputation of causing damage, because you don't want that.
And if you're using products that you're seeing sensitivity with, can it be a combination of, let's say, the weather as well as the products that you're using?
I think very definitely it'd be a combination of a lot of things. What's going on in your life? What kind of stress do you have? What's going on at your job? What's going on with your family? All these things that make up life, and they'll definitely affect the skin. So what we want to have is a smooth, real nice life, and that will reduce stress, because stress has a lot of damage to the skin.
So would you then suggest eliminating possibly one product at a time?
Well, that's certainly a way to go at it. Eliminate them one at a time, and then you know if it was the culprit or not. If it wasn't, you bring it back in. If it wasn't, you pitch it.
Is it okay to exfoliate sensitive or ultra-sensitive skin?
Very gently.
And can you talk to me a little bit about what rosacea is?
Rosacea is a congenital abnormality of a plethora of superficial capillaries in the skin, most commonly across the nose and the face. You see this in people. And there are many treatments, none of them specific. You can't say, oh, you got rosacea, take this, it's done. You have to keep at it. And there's topical things you can use. There's also a laser that I happen to use that I've had very wonderful success with. The beauty of a laser in this treatment is that you can aim it to the top of the dermis where all of these dilated vessels are, and in essence ablate them. So yes, there's lots of ways to go at it, but you got to keep at it. You can't. There's not one treatment that's going to take care of it.
So rosacea is treated over time, and it's something that you will have for a period of time rather than just something that you have that you can get rid of in a couple of treatments. Is that true?
That's true. It's more likely to be with you most of your life to varying degrees, depending on the success of treatment, depending on the abundance of rosacea you have, and other factors, stress that we've talked about in the past, and medical conditions. We should all strive to be in the best health we can be, but we're lazy, so we don't do that.
Is there anything that a person does that causes them to get rosacea, whether it's a product or being in the sun too long?
Well, I think sun damage probably is a culprit, but there's no common denominator. It's not a contagious disease. It's not an infectious disease. It's more congenital. And some people have it and some don't. You see it in the lighter skinned people more than you do in darker skinned people.
And we will return shortly after these messages. Bionic Body Bites for Men provides the perfect amount of vitamins, minerals, antioxidants, and herbs for the unique needs of men. Bionic Body Bites for Men are sold exclusively at beautyplum.com.
Wonderful. Can extreme weather, stress, strenuous exercise, alcohol, and certain foods stimulate ultrasensitive skin?
Well, I think those questions, yes, as a general answer. But I think when you're talking about certain foods, some people are sensitive to them. Some people are sensitive to medications. Some people are sensitive to criticism. Some people are sensitive to stress. And these things can manifest in the skin. So keep in mind, it's the largest organ system, and it's a target area for stress. And it'll target it in many different ways, in the ways of rash, in the way of urticaria or spots on the skin, red, white spots. It's very, very effective on the skin.
If a person is suffering from sensitive skin, how can they control their acne?
Well, whether it's sensitive or not, they control their acne. The gold treatment of acne is a program. It's not one particular thing. In that program is a cleanser, is an exfoliator to help reduce comedone formation. We've talked about Retin-A a lot. It's an anti-comedonal medication. And you'll see on labels of a lot of different products, anti-comedonal. Those are going to be better for the skin than those don't say anti-comedonal. It's a persistence in treatment, a commitment to having the best skin, and avoiding the sequela of acne, which is scarring. And if it gets to be cystic and inflamed and infected, then you've got to do other things. You've got to take systemic antibiotics. You've got to take topical antibiotics. Sometimes people will revert to Accutane. And many people have heard of Accutane. It's a vitamin A product, but it also has teratogenic effects. And if a woman is using it and becomes pregnant, there's a very good likelihood that that child would have congenital abnormalities. So they have a organization called iPledge, and before you're even allowed to get acne, you have to commit yourself to iPledge, which is celibacy and take care of your skin. In other words, you take care of both things.
Okay. If you have super sensitive skin, are you a candidate for Retin-A that we know can keep you looking young?
To answer your question, everyone is a candidate. How that super sensitive skin person reacts to the Retin-A, we do have various degrees of complexity of the Retin-A, from 0.025, 0.05, 0.1, and on up. So that person, we would start with absolutely the most dilute Retin-A of all. We may have them use it only every 3 days or every 4 days, and ultimately work up to where they're using it every night for a year. Then after that period of time, they're going to experience the ultimate effect, and then they cut back a little bit to 4 or 5 days a week.
And my final question is, if you have sensitive skin at one point of your life, will you always be a person with sensitive skin?
Always. That's like a true-false question. Not always, but most likely more sensitive skin than, say, someone who grew up in the West Coast and spent their time in the sun beating themselves up and having tough skin. Manicure skin is a lot tougher than women's, thicker, more sebaceous glands and more protective. Melanin has a lot to do with protection of skin. Very light-skinned people who always sunburn and never tan are more likely to have problems than the person who suntans beautifully and rarely sunburns. So it's a difference in skin type as well.